Greetings from Sanjeevini Hospital. This is Dr. Subhash, MD, representing a super speciality hospital located in the west of Bangalore. Recently, we operated on a case which I would like to present to you. The disease condition is called as Moya Moya Disease, a rare neurosurgical disorder which came to us from Bangalore district. Moya Moya Disease is a condition wherein the carotid artery is narrowed or blocked, causing reduced blood supply to the brain. Due to this, the patient presents with the complaints of nausea, vomiting, headache, giddiness. There might be involuntary movement, loss of movements on one side of the body. There might be even visual disturbances, and there might be even loss of speech. The cause of the disease is unknown, but it's usually seen when there's a family history, and usually seen among the Asians like Japanese, Chinese population and Korean population. This also disease is seen in cases of wherein a patient has got a neurofibromatosis or a patient is having a Down syndrome. This Moya Moya disease patients are usually diagnosed by CT, MRI and cerebral angiograms. The treatment aspects involves medical and surgical management. Medical management is usually done with blood thinners and calcium channel blockers and anti-seizure medications. If this patient doesn't improve with it, then we go to the surgical management, wherein it is called as a revascularization procedure. We bypass the blocked arteries by connecting the arteries from the outside to the inside of the brain and revascularize the area, bypassing the blocked arteries. Connect the superficial temporal artery to the middle cerebral artery, and thus we are bypassing. This is similar to cardiac surgery where we do a cardiac bypass. There also you bypass a blocked artery and you connect the one part of the artery to the other part. So the revascularization is achieved. Similarly here, in simple terms, we can tell it as a brain bypass surgery. Two procedures are being done here. One is encephaloduro-arteriosyngangiosis and encephalomyosyngangiosis, wherein you place a artery of the scalp on the surface of the brain through a small opening in the skull, wherein this artery grows into the brain and causes a revascularization of the brain. And above that, we keep a small muscle from the temporal area on the scalp artery. So the revascularization happens. This procedure is a very higher end procedure done by very few neurosurgeons, which we achieved at Sanjeevini Hospital. Patient became all right, and all the complaints of nausea, vomiting disappeared in the next 2 to 3 days. I thank the neurosurgical team for the hard work, namely Dr. Anirudh and his operation theatre team. I thank one and all of you for achieving this feat, making the patient a happy woman and go and lead her life happily at Ballari.
ನನ್ನ ಹೆಸರು ಸುಭಾನ್ ಅಂತೇಳಿ. ನಮ್ಮ ಮಿಸ್ಸಸ್ ವೈಫು ಕುತಿಜಾವಿ. ಅವರಿಗೆ ತೆರೆನೋವು, ವಾಮಿಟಿಂಗು ಜಾಸ್ತಿ ಇದ್ಮೇಲೆ ನಾವು ಊರಲ್ಲಿ ತೋರಿಸಿದ್ವಿ ಡಾಕ್ಟ್ರ್ ಹತ್ರ. ಅಲ್ಲಿ ಅವರು ತೆರೆನೋವು ಜಾಸ್ತಿ ಇರೋದ್ರಿಂದ ಬೆಂಗಳೂರು ಹೋಗಿ ಹಾಸ್ಪಿಟ್ಲಿಗೆ, ದೊಡ್ಡ ಆಸ್ಪತ್ರೆಗೆ ಹೋಗ್ರಿ ಅಂತ ಕಳಿಸಿದ ಮೇಲೆ ನಾವು ಬೆಂಗಳೂರಿಗೆ ಬಂದ್ವಿ. ಬೆಂಗಳೂರು ಬಂದು 2-3 ಹಾಸ್ಪಿಟ್ಲು ತಿರುಗಾಡಿದ್ವಿ, ಆದರೆ ಅಷ್ಟೊಂದು ಗುಣಮಟ್ಟ ಆಗಿಲ್ಲ. ಆಮೇಲೆ ಮಹಾಲಕ್ಷ್ಮಿ ಲೇಔಟು ಸಂಜೀವಿನಿ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬಂದಿದ್ವಿ. ಬಂದಮೇಲೆ ಅನಿರುದ್ಧ್ ನ್ಯೂರಾಲಜಿಸ್ಟ್ ಹತ್ರ ತೋರಿಸಿದ್ವಿ. ಅವರು ಸ್ಕ್ಯಾನಿಂಗು, ಎಕ್ಸ್ರೇ ಎಲ್ಲ ಮಾಡಿ ಅವರು ಮೋಯಾ ಮೋಯಾ ಡಿಸಾರ್ಡರ್ ಇದೆ, ಸರ್ಜರಿ ಮಾಡ್ಬೇಕಂತ ಹೇಳಿದರು. ಆಮೇಲೆ ನಾವು ಸರ್ಜರಿ ಮಾಡಿಸಿದ್ವಿ. ಆಗಸ್ಟ್ 31ಕ್ಕೆ ಸರ್ಜರಿ ಮಾಡಿಸಿದ್ವಿ. ಟ್ರೀಟ್ಮೆಂಟ್ ಎಲ್ಲ ಚೆನ್ನಾಗಾಗಿದೆ, ಡಾಕ್ಟ್ರು ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗಿದೆ. ನರ್ಸು ಆಮೇಲೆ ಎಲ್ಲರೂ ಬೇಸಾಗಿ ನೋಡ್ಕೊಂಡಿದ್ದಾರೆ ಇಲ್ಲಿ. ಥ್ಯಾಂಕ್ ಯು ಸಂಜಯ್.
ಥ್ಯಾಂಕ್ ಯು.